Just those of you who don't know me, my name is Ravi Jain. I own Riverbanks Clinic. I've been here since 2008, so we're in our 16th year. And I've been fortunate enough to be an expert for a few companies, which has led me to teach thousands of clinicians globally. And one of the treatments I do teach on is Sculptra. I started offering Sculptra to my patients actually in 2008 because I've been practicing for a few years beforehand. And to be fair, it's come in and out of fashion. And right now, it's overwhelmingly in fashion. There's a big trend for Sculptra right now. So today's talk is going to be about new science. I'm going to explain what Sculptra is as we have previously understood it, the exciting science about how it modifies gene expression, and how that lends itself to regenerate fatty tissue. And now that doesn't mean you're going to get fat faces. This doesn't mean pillow faces. And what I'm going to explain to you is how and why fat cells are very important for overall skin health. And on the back of that, we can now then understand why some people are now treating Sculptra in newer areas, whereas previously it was just limited to the face. So what is already known about Sculptra? First of all, some of you I know from who are attending have had Sculptra and are great fans of it. As it says, Sculptra is made of a substance called Poly-L-Lactic Acid. Now that sounds very harsh and very acidic. The background behind Sculptra is that this substance was used for dissolvable stitches, internal stitches that the surgeon would use, and they would break down over time. One of the reasons this substance was used because it actually enhanced the wound healing process by forming extra collagen for those two parts of skin or tissue to be stuck together. So it facilitated the wound healing and the rejoining of tissue. This product was then powdered and dissolved and then applied for facial rejuvenation for people who suffered from a lot of fat volume loss, primarily from in HIV and AIDS sufferers who the side effects of the early drugs in combating HIV was facial wasting. The fatty tissue would waste off their faces and would regenerate that volume. And we thought it was just regenerating the volume with collagen, but now we know otherwise. So it's got a long history in facial regeneration. It's got a long history in medicine. We know virtually everything about how it works, what it does, what happens when perhaps there's a few little issues like little bumps or something like that in some people. We know how to minimize those risks. But one of the best things about Sculptra is that its results are gradual. Now, you'd think that in this day and age where people want everything yesterday, that's not such a good thing. But actually, we're seeing that people want to look natural. They don't want to have a sudden change overnight, which is what we tend to get with full face correction with fillers. So this takes about 6 to 8 months to develop. During that time, it's producing more tissue, and your skin's getting firmer and tighter, and if you want, fuller. And then after that, the results can last about 2 years. So you're looking at about 2 to 2.5 years of duration of results. If you want to maintain and prevent yo-yoing, then you suggest a top-up treatment once every 12 to 18 months, but it's like a fraction of the amount of the treatment you'd have to start off with. It's very versatile. It can now be used in many parts of the body, which I'll talk to you about later. And there is literally hardly any downtime. One of the differences between Sculptra and other tubes that you do have to massage after this treatment. That's part of the care. And I show you how to do that. And I've got a video on YouTube explaining that to you, how to do the massage to maximize results and minimize any complications. It's actually our most popular video on YouTube. We've got about 30,000 hits on that with lots of comments from patients around the world. Okay, so as we age, unfortunately, once we get past 20, and I'm sure most of us are past that, our collagen declines dramatically each year. So you can see how the collagen level when you're 20 drops from 86 to 60 to 35 to 20. So by the time we get to about 50, it's virtually all gone. And it's so depressing. But we can actually start to reverse this with Sculptra. Collagen stimulation is what many treatments have tried to achieve. With Sculptra, it does this by invoking a foreign body response. So the particles of Sculptra that are injected into your skin, the body recognizes those as a foreign body. This is alien. So therefore, it creates a little capsule around the Sculptra particle to protect it from the body. That reaction creates a collagen production reaction, and it's a collagen type 1. And there are many different types of collagen. There's a collagen type 1, which initially is a scar type reaction. So it's a hard tissue. After about 3 months, this turns into collagen type 3, which is the skin tissue, the skin type collagen which we see in our skin. That's why it takes so long to see the outcome of the results, because we tend to do a course of treatments once a month for 3 months. If you think it takes about 3 months to see the new skin growing after the first treatment, it's going to take another 3 months after the third treatment. So the earliest you're going to see a treatment from the third treatment is 6 months from the start. So what other collagen stimulators are there? There's Radi-S, which was one of the first collagen stimulating injections out there. We used to use that years back. We now use a lancet instead. There's Harmonica, which is a combination of hyaluronic acid and Radi-S, so calcium. There's Langluma, which is a copycat product for Sculptra, and then there's the original Sculptra. And Sculptra by far has the most scientific research around the world on it, and that's particularly thanks to the current manufacturers, Galderma, who have really invested heavily in research to identify how does this product work, what are the possibilities with it, and what happens when it goes wrong, and what can we learn about that. Other collagen stimulators, which produce a minimal scar type reaction, so type 1 again turn into type 3, microneedling and RF microneedling, and of course laser resurfacing and radio frequency. So these all cause small amounts of damage to the skin, creating an initial scar and then normal skin afterwards. We've got 16 years experience using Sculptra. And I'm excited to learn even more that there's new knowledge coming out with this product. So listen, I'm going to go through a few papers and I'm just going to highlight a few points. Now, this paper, which was written by Jill Weber, and she compared Radi-S to Sculptra, Poly-L-Lactic Acid. And she wanted to identify which one was better or worse, or were they the same in helping fat cells regenerate. And the key here is regenerate, and the other key word is fat cells. And they compared the gene expression between the two products when treating nasolabial folds, so the nose to mouth lines. And they took biopsies from the patients at the start and after 90 days, and they analyzed the gene expression of these fat cells. And what they showed, that Poly-L-Lactic Acid, so Sculptra, was the only one which was involved in fat cell regeneration. Radi-S did not affect these genes. Both of them did help stimulate collagen stimulation. Sculptra did that more, but Sculptra is the only one that went beyond improving collagen, and it was because it was unique in the way it supported a potential regenerative mechanism of action through its role in the modulation or the changing behavior of fat cell function. So this is really exciting. I just summarized it there for you. So what was good was that Sculptra also has a potentially positive effect on fat cells with a healthy profile that can improve all 3 skin layers. And this, in practice, this translates into skin quality benefits such as increased skin glow, improved facial fat function, I'll come on to that in a second, and structure, and reduced signs of facial aging. Further studies showed that the prolonged effects are associated with the differentiation of adipose-derived stem cells, resulted in mature fat cells with an increase in fat cells, which both contribute to long-term fat tissue volume, and that there has been an increase in the amount of dermal white adipose tissues. Now, this is going to be a buzzword this year, dermal white adipose tissues. This is a recently discovered structure within the skin, dermal white fat cells, basically. We always used to think that the fat cells sat below the skin, and now we understand that dermal white, the skin does contain some cells of fat cells, and these have a profound effect on skin health relating to the barrier functions, the vascularity, the way the skin glows, its volume, its structure, its elasticity. So now you can understand that why when people lose weight, their fat also shrinks. It's not just the fat below the skin, it's also the fat within the skin that causes those fine lines and wrinkles. And then Sabrina Fabi from San Diego, and she does a lot of studies and research there. And she looked at a study where she treated the hip dip with Sculptra to see whether or not it was just collagen or fat cells regenerating. And she treated the hips on one side of the patient, and on the other side, she treated just with saline. And this was on 15 women. And she noticed that the adipose layers, the fat layers, increased in thickness by about a quarter. So that's significant compared to saline. So dermal, remember that phrase again? Dermal white adipose tissue. It's a newly recognized fat deposit, functionally and developmentally distinct from subcutaneous fat, the fat below the skin. These may be required for normal skin function, including the hair cycle, keratinocyte, the extracellular matrix, which includes hyaluronic acid, and defense against, and also barrier function. Okay? So we know that now that fat cells this area, these fat cells, these dWAT cells are actually included in the use of Poly-L-Lactic Acid Sculptra. Have you all got your PhDs yet now? Anyway, so now there's another study and where we're looking at how Poly-L-Lactic Acid, it's a Sculptra, can be used in the neck. Now, Doris Hexel is one of Brazil's most experienced and revered dermatologists. She's done huge amounts of clinical studies and work on numerous treatments. And what she saw was that she looked at 36 patients with skin laxity and wrinkling in the neck and chest. And what she showed that in 21 cases, there was improvement in 81% of them. And the patients felt 90% of the patients said they're pleased with the results. So let me just summarize why the dermal white adipose tissue is good for you and why we need it. It supports skin structure. It enhances skin hydration. It regulates blood flow. It improves skin regeneration. It enhances skin barrier function. It prevents excessive inflammation, and it also maintains contours. Now, Sculptra is the only product that's been shown to have a possible effect on this structure, and in a positive effect, a regenerative effect. None of the other products out there have been shown to have the same impact. So if you want true tissue regeneration of your face, for example, Sculptra is the product anyone needs to start with. Then you can tweak it with maybe some collagen stimulating fillers or some hyaluronic acid fillers, but you're going to get glow, strength, vascularity, and overall tightness and barrier function, as well as contour, by improving this structure within the skin. Which brings me on to the latest trend in the world is the Ozempic and the GLP-1 analogs such as Wegovy, and there's plenty of other drugs, injectables that help reduce weight quickly. And people always thought that the Ozempic face was caused, so the Ozempic face is when people lose weight suddenly and they suddenly become gaunt. And they're very happy with their bodies, but they're very unhappy with their face. And what's now been identified is not just a matter of loss of weight on this fat below the skin. What we now understand is that this accelerated facial aging and altered skin health absorbed in these patients appears to be multifactorial, involved in the loss of dermal white adipose tissue and the subcutaneous white tissue. And we also know that these GLP-1 drugs act directly on these types of tissues, reducing them, breaking them down. In other words, what's been hypothesized and looking into much further is that these weight loss drugs, such as Ozempic, are actually unhealthy for the skin. They may be great for the waistline, but they're not great for your skin health. And it's not just the face, it's affecting it all over. We know that they reduce muscle bulk as well. So here are some clinical results. These are from Doris Hexel in Brazil, and you'll see that she had 2 sessions of Poly-L-Lactic Acid in her neck. I would dilute those much more than 8 mils now, because to reduce the complications of nodules. But you can see about 4 months later, there's a really nice improvement of what beforehand there was very little we could do with the neck in this instance. A nice simple treatment with very little downtime. Here again, you can look at the laxity in the mid neck. Look at these creases along the middle of the neck. Look at how the laxity here is. Now that's tightened the neck completely. 2 sessions again, 68 years old. Now what's left are these 2 platysmal bands. She just needs a couple of shots of Botox in those, and then she'll have a flawless neck. It works equally well on the décolleté. Now we've tried skin boosters and Profilo on the décolleté for these vertical creases, which happen usually in women's 40s and beyond. If you inject Sculptra into this area, you get really nice outcomes. Okay, really nice outcomes. So much younger looking chest. And all she needs now is some V-beam or IPL or a skin peel to reduce the pigmentation on from the sun. Again, you can see here much better tightening and volume of the skin, reducing the creases that we see. So now this changes people's lives, changes how they wear their clothes as well. And then here's our patient who was on our last Sculptra talk, and she's 70 here and 2 years later here. And what I think you can see is that her skin looks so much better than before, and she had 1 course of Sculptra. And I'll just show you, but she's also had a combination of other treatments, even since the Sculptra and before. And just to show you how combination treatments work well, she's joined the practice in 2015 and had some fillers. She had some HIFO treatments, some late CO2 laser, cool sculpting, hydrofacials, and Profilo. And it wasn't until 2021, which is here, 2021, here, where she had Sculptra. And she had a course of 2 or 3 treatments in 21, and this is in 2024. So so now what we're going to do for her is treat her. I'm going to recommend that she treats her neck as well when she comes to maintain her face. Okay, so I'm going to summarize what we know about Sculptra now. We know that it's safe. We know it stimulates collagen. It also regenerates the fat cells in the skin, which are vital for normal skin health and function. The results are gradual. They last 2 years plus, and it now can be used on the face, the neck, the décolleté. We even use it on the knees, on the abdomen. We use it on the upper arms. Wherever you've got skin laxity, we can use Sculptra, so long as it's not the eyelids, the forehead, or around the mouth. And there's very little downtime. It's not suitable for those who've got active disease and active autoimmune disorders, because they have a higher risk of reacting to the Sculptra. That foreign body reaction might be excessive in those patients. Anyone obviously under 18, we don't treat, and anyone who's pregnant or lactating. It's great in combination, including thread lifts, including dermal fillers, but not necessarily in the same area, as well as our other collagen stimulating treatments at the practice. If you're not already, and I know a lot of you are following us on Instagram, we do a lot of fun stuff on Instagram, but we also do a lot of interesting tips, how to get the most out of your skincare, how to get the most out of your treatments, what treatments work best, what's new, who's joining the team. And also on our YouTube channel, what I would recommend you do is you search for Riverbanks Aesthetics Wellness. I've got now a separate channel on there for aftercare videos for all of your treatments. So if you're ever not sure what to do after treatment, you go to there and you'll find there's a library of videos of me or the team explaining to you. Okay, so is Sculptra suitable for people over 50 with aging skin who have not suffered from weight loss? Absolutely. It is suitable for, we would just use different amounts of Sculptra, because the more Sculptra you use, the more volume correction you got. So if you're just looking for some skin tightening, and there's no volume loss in your face, I would suggest using maybe probably 2 vials of Sculptra, and then leave it and see how you get on over the next 3 to 6 months. So that's a great question. Thank you very much. Does it work on the hands? Absolutely. You tend to need 3 vials of Sculptra. So 1 vial at a time. So 1 vial, half a vial for each hand. Do that every month, 3 times, and then wait 6 more months for the end result. And usually that will last you about 2 years after that. The reason it can't be used around the mouth is because the way the muscles work around the mouth, they will cause the Sculptra particles to gather together. And no matter how much massage you do, they will gather and stick and therefore form lumps of collagen. So it's really not a wise move to do that around the mouth. It's a shame. Anyone with active or autoimmune disease, it's a really high risk treatment to take on board. And I wouldn't be comfortable using it in anyone with an active autoimmune disease. Would I recommend Sculptra over CRF, which I have? Is it more for damaged skins? No, I think it's a great combination treatment. There comes to a point that CRF is going to work on collagen stimulation, and it's going to tighten the skin. It's going to there's very little downtime. There's nothing foreign injected into your body, so you can never get a foreign body reaction. Sculptra is the most potent collagen stimulator. We now know works on tissue and fat cell regeneration. So it's on its own in that aspect. So they do like slightly different things. You can have both, absolutely. And we do have patients that have both, and they just get outstanding outcomes, as you've seen with the lady I showed in one of the pictures. If treating the face only, how many vials would you expect for an initial treatment and follow-up? Typically, we're looking at about 5 vials for a face. It does depend on the size of the face. It does depend on the volume loss and how much correction we're trying to achieve. Those 5 vials may be spread across 3 months. They may be spread across 6 months. But most people require 5 to start off with, unless they're, I would say, they've got a very full face. And I always do a consultation to assess for suitability and discuss expectations. Certainly, if you're an existing patient of mine, those consultations are complimentary. And if you're a new patient who I've not seen before, we offer those consultations cost £100 to start off with. So yes, absolutely, I can combine Sculptra with threads. In fact, some temporary threads, such as Silhouette Soft, are made of the same material as Sculptra, but they're working at a different level. They're not working within the skin. They're working deep below the skin in the subcutaneous fat tissue layer. So they don't get quite the same result on the skin as Sculptra does. It doesn't show immediate results. Can it be combined with filler or other treatment that shows more immediate results? Yes, I mean, Sculptra isn't going to show immediate results. We know that for a fact. It's going to take 6 to 8 months. You can put in another filler, but I wouldn't necessarily put it at the same time. I would wait for the Sculptra to work first, because you're just increasing the risk of reactions between 2 different agents in your skin. What I would do if you wanted quicker results is work with a collagen stimulating filler first, such as a Lance or a hyaluronic acid filler first. Do that. And then when that starts, maybe 6 months later, then do some Sculptra, so that you tend to get a transition period. Okay, we've got 2 more minutes. Yes, you can still have Botox with Sculptra, but not on the same day if you're treating the face, because of the massage. If you have Botox around the sides of your eyes, and I've inserted Sculptra around the sides of your eyes, I don't want you massaging the Botox into a different area. So it might just have to be on a week or 2 later.